Hi, my name is Dr. Felicity Brown. I'm a clinical psychologist and senior researcher at War Child Holland. Today I'm going to first give an overview of the challenges that families are facing in the contexts in which War Child Holland works, which is conflict-affected settings. Then I will share 3 key considerations that are relevant for supporting families as part of the global response to the COVID-19 pandemic. I hope that after watching this video, you'll also watch another video in the series by my colleague Dr. Ken Miller, where he'll provide some more practical tips for how to support families right now. So first off, we know that a nurturing family environment is absolutely essential for healthy child development and for their current and future emotional and physical well-being. In the contexts where War Child works, many families are already facing a complex web of challenges related to their situation. They may have experienced exposure to armed conflict in various ways, political instability, and the consequences of displacement and living as a refugee. But it's not only these direct exposures that contribute to challenges for families. We know that the systemic daily stresses that families are facing are just as impactful. These are really varied, but they can include things like exposure to adversity in living conditions, increased violence in communities and in homes, structural discrimination at various levels, bullying, lack of livelihoods opportunities, poor access to basic services, interrupted education, and the pervasive multi-layered effects of poverty. As a result, many families are experiencing mental health difficulties among both children and adults. We also know that parents can face significant challenges in raising their children in these conditions, and the use of harsh physical discipline can increase. The use of substances to cope and also an increase of violence in the home are both, unfortunately, really common as well. These problems can combine and interact to really result in a significant negative impact for families, making it difficult for even the most resourceful and resilient families to cope in these situations. Despite the high needs in these settings, access to appropriate services for families is severely limited in the context in which War Child works. Where services do exist, they're often highly fragmented and siloed. So families might need one referral for their basic needs, another referral for their income support, one referral for parents' mental health challenges, and a separate one for their parenting challenges, and so on. This makes it really difficult for families and makes it really easy for them to fall through the cracks and be left without the services that they need. We also know that it can cause extra frustration when their needs are not considered holistically. For the families that we work with, the COVID-19 pandemic will have only worsened their situation, even if they never come close to the actual virus itself. Most are being unable to leave home for work, and therefore income is drastically impacted. There are reports of increased family violence. Many services have stopped or are restricted. Families are cramped into tight living spaces, often without adequate water for drinking, let alone for hand washing. In most of the countries in which we work, national health systems and economies were already struggling before the COVID-19 pandemic. There's limited government financial support for communities, and health systems are putting the necessary efforts into fighting the pandemic, leaving less resources to focus on mental health and well-being. In terms of recommendations for supporting families in the COVID-19 response, firstly, I'd urge the global community not to forget about the most vulnerable families. Families in all countries will be struggling with a lot of the experiences mentioned above, but the impact will hit the most vulnerable families the hardest. Secondly, I'd also urge the global community to consider the family system as a whole. Especially where access is restricted and resources are limited, we can just no longer continue to provide discrete services for one problem with one family member at a time. We need to work together across sectors, across disciplines, and across organisations to take integrated approaches that consider the needs of the entire family system at the core. As an example of this way of thinking, War Child Holland, as part of our research and development agenda, is developing an integrated multidisciplinary intervention to support multiple families experiencing multiple problems. We are developing this intervention with multiple international and local partners. The intervention will be unique in that it will combine attention for many of the challenges families are facing in one package. So it will consider family interactions, mental health and substance use, positive parenting, reducing violence in the home, and financial stress. We recognise that addressing one piece of the puzzle at a time will not be sufficient to bring about meaningful change for families where multiple problems converge and interact. I urge other donors, organisations and responders to also consider family systems in this holistic way when designing and delivering services. We need to provide sustainable systemic care, make use of existing services, use contextually relevant content, and build trusting relationships with families and communities. Thirdly, I'd urge the global community to focus on mobilising the existing strengths of families. It's important to recognise that families coping with multiple and compounding stresses can benefit from support in nurturing and building the necessary skills to mobilise their existing strengths and work together as a strong family unit to reach their full potential, despite the significant adversity they might find themselves in. Sometimes the challenges can seem overwhelming, especially when we're now adding another crisis on top of existing crises for some of the families that we work with. But we know that supporting families is an effective way to promote optimal development of children and prevent future emotional problems and promote future well-being. Working together, we can make a difference to the lives of these families. Thank you.